Good evening, everyone. Thank you for coming to our first event for the month of May. For some of you who have just joined us, I'm going to go over some housekeeping to keep the meeting secure. This is a webinar, so your video and microphone will remain off for the duration of the meeting. The chat is open and you're encouraged to send any questions to the hosts and panelists using the chat function. Your questions will be answered at the end of the presentation. All of our events for this month are dedicated to the memory of Dr. Lynn Marshall. Dr. Lynn Marshall has had a tremendously successful career as a physician spanning over 55 years, working in comprehensive family medicine, occupational medicine, environmental medicine, general practice, psychotherapy / hypnotherapy, and epidemiological research. She was the recipient of numerous awards in environmental medicine, and Lynn was an advisor to ASEQ-EHAQ, where she provided her knowledge, expertise, and support to help build the association to the organization that it is today.
Good evening, everyone. My name is Rohini Paris. I am the president of the Environmental Health Association of Quebec. Welcome, and thank you for being with us today. Multiple chemical sensitivity, MCS, is a chronic health condition triggered by exposure to chemicals commonly used in our environment. MCS is a recognized disability by the Canadian Human Rights Commission, protected under the Canadian Human Rights Act. In Canada, 2020 data from Statistics Canada shows that 1,130,800 people have a diagnosis of MCS. The prevalence of this health condition is increasing according to similar data from 2000 to 2020. Despite being close to 4% of the Canadian population and a part of the 22% of other disabilities in Canada, there is very little to no help or support for the MCS population. Similar data mentioned above shows the heavy burden of this medical condition on people experiencing it, and it also shows that it is impossible that anxiety causes MCS, as was recently wrongly stated in a report released by the National Institute of Public Health, Quebec. Efforts to place this condition under the umbrella of mental health conditions or association with it only leads to increased misunderstanding, lack of care, loss of employment, poverty, isolation, homelessness, and stigmatization. Canada ratified the United Nations Conventions on the Rights of People with Disabilities in 2010 and adopted the Accessibility Act in 2019. Yet, barriers such as stigma and exposures to chemicals continues to exist to date. Today, we have Dr. Stein with us to speak about the burden of MCS. Our initial meeting with her was to seek help, which has led to today's event, which Dr. Stein so graciously accepted. Thank you for accepting our invitation, Dr. Stein. For the past 21 years, Dr. Stein has been intensively learning about diagnosis and management of ME/CFS, chronic fatigue syndrome, fibromyalgia, and environmental sensitivities. She is a psychiatrist and psychotherapist with an appointment in the Department of Psychiatry at the University of Calgary Faculty of Medicine. She teaches a class on ME/CFS to first-year medical students and mentors students who want to learn more. Dr. Stein is one of a handful of experienced clinicians for these conditions in Canada and is involved with 2 research teams at present, providing clinical expertise. Dr. Stein's goal is that every Canadian with ME/CFS, fibromyalgia, and MCS receive effective and respectful treatment within the public healthcare system. I now pass this on to Dr. Stein.
Thank you very much. My name is Dr. Ellie or Eleanor Stein, and I'm really honored to be asked to speak about my experience with MCS at this very important time for MCS in Canada, and also to be speaking at an event honoring my longtime colleague, Lynn Marshall, who did so much to bring environmental medicine to the mainstream. I am a psychiatrist. Please don't hold that against me. I have a small private practice in Calgary. I'm speaking today as a physician who's worked in the field of multiple chemical sensitivity and associated diseases for over 20 years, and also as a patient who has had MCS for as long as I can remember, along with the full alphabet of allied diseases like ME/CFS, fibromyalgia, orthostatic intolerance, mast cell activation syndrome, and so on. A quick introduction. Environmental sensitivity describes a chronic condition whereby a person has symptoms when exposed to certain chemicals or other environmental agents at low levels tolerated by most people. That's the key. The symptoms can range in severity from mild to debilitating. Environmental sensitivities is an umbrella term. It includes people who are sensitive to chemicals, they have MCS, people who are sensitive to electromagnetic frequency, like electricity and Wi-Fi, they have EHS, electro hypersensitivity, and also people who are sensitive to biological toxins, most commonly those produced by toxic mold in water damaged buildings. In case some of you are new to this field, you may not be aware just how common MCS is, although that was just mentioned in the introduction. So just to quickly review, the Canadian Community Health Survey undertaken by Statistics Canada shows that over 1.1 million Canadians have been actually diagnosed with MCS. This represents about 3.5% of all Canadians. Now, probably this is a gross underestimate of the true number of people affected, because in research by Dr. Ann Steinman in the United States, 12.8% of the population reports medically diagnosed MCS, and 26% report chemical sensitivity. So this is a huge number of people. And as you can see from this chart, the number is increasing, possibly related to the increasing levels of pollution in our daily lives. So what kind of symptoms do people with MCS experience? So I'm just laughing at this cartoon because that's exactly how I used to feel when I was exposed to chemicals. The symptoms can affect the whole body, but often they have to do with the head and the central nervous system. People feel dull or groggy, they have trouble concentrating, they feel spacey. They often report a heightened sense of smell. A lot of people have pain, especially headache pain, numbness, tingling, fatigue. They often have bowel and bladder symptoms, skin rashes, itching, hives, and so forth, breathing problems. It's very broad. So in a moment, we're going to play a short clip from this YouTube video. But I would recommend that after the session, you might go and play the entire video for yourself. It will help you learn what it's like to have MCS. And it's especially a great video to show others, maybe family members, for example, what your experience is like.
It ranges from shortness of breath and trouble breathing to itchy skin, brain fog, incredible fatigue, joint and muscle pain.
I actually would get to the point where my airways, my stomach and everything would feel like there was a swelling inside them. And then I actually would get blood coming out of my nose. And I know at one time I would break out in hives from the chemical reactions.
My heart rate goes up immediately. If I get like brain fog or my vision gets blurry, like it's really scary. Like if I'm driving and I can't think, that's a problem. And it's very frustrating that I can't live a quote unquote normal life.
The worst thing about having MCS is the isolation. With this disability, I have to really second guess every social outing. I have to ask for people to accommodate me and hope that they will.
Like if I want to date somebody, you know, and having to tell them, oh, you need to change your shampoo, you need to change your soap, your laundry detergent.
I'm isolated because I have to work from home, and I live home alone, so I'm at home alone all the time.
One of the biggest repercussions of having MCS that sort of stopped me in my tracks in my career, because I couldn't work in an office, I had to sort of cut my career off there. And not only did I lose that career path opportunity, but also limited other types of work that I could do.
I lost everything. I lost all the money I had. I lost my business. I lost everything at that time.
Thank you. So in this presentation, I've been specifically asked to discuss the connection, if any, between multiple chemical sensitivity and anxiety. And being a psychiatrist, I've given this a lot of thought. This is the area in which I've, in all of these diseases, MCS, ME, FM, etc., I've been asked to comment over the years. So the first question is, do people with MCS experience anxiety? I'm going to explain my answer slowly over the next few slides, because without providing appropriate context, the answer to this question will lead to false conclusions. The answer is yes, many people with MCS experience anxiety, but the key is that many do not. From my clinical experience, I would estimate that as many as 50% of people with MCS also experience anxiety, so it is quite high. Keep in mind, however, that the numbers of people experiencing symptoms is always higher in clinical populations, meaning people who go seek out medical care, than in the general population. Of course, people with anxiety are more likely to seek help than others. So probably the real rate of anxiety among people with MCS is lower than what I see in my practice. If MCS were a type of anxiety, then the rate of anxiety in people with MCS would be 100%, and it clearly isn't. So a better question to ask is not whether people with MCS have anxiety, but if they have it, why do they have it, and what does it mean? So in this slide, I talk about why do people in general, not just those with MCS, develop anxiety. Anxiety is most often a normal response to circumstances. It's even described by some as a rational response to an irrational world. The mnemonic NUTS speaks to this. If you put people in a crucible with certain experiences, almost everyone will become anxious. So here are the 4 things to consider. N, novelty. Are people experiencing constantly new things? Unpredictability. Are these new things unpredictable? And I think we could say negative. Is there a threat to people's sense of competence or ability to function? And do the circumstances give a sense that you don't have control? People with MCS face all of these anxiety-provoking circumstances, usually every day, and usually with no validation or support. They're constantly at least at the beginning, they're constantly experiencing new symptoms. The symptoms are unpredictable. People have no way to know when they're going to be exposed to chemicals, for example. They're very threatened. They can't do all the things that they used to do, and they have no control over exposures. So perhaps it could be argued that for some people, anxiety is a rational response to these circumstances. It's important to note the role of the medical system in the lives of people with MCS. People with MCS are usually unable to get an accurate, timely diagnosis. They're unable to get treatment or support. They're often disbelieved and even dismissed by their healthcare providers. They're often unable to get needed disability support or accommodations at school or work because they don't have a diagnosis and their doctor doesn't understand their limitations. The medical profession ignores their contribution, the contribution of their own actions, their invalidation and inadequate treatment of MCS. It's a classic case of blaming the patient for the deficiencies of the medical system. Imagine if a patient with any other disorder, say cancer or heart disease, were told by their physician that they likely weren't sick at all, or if they were, it's due to a mental health disorder, and that there would be no support or treatment being offered. It would be totally unacceptable, and yet this is what people with MCS face every day. It's important to consider, where does the locus of anxiety lie? My observation is that this anxiety experienced by people with MCS is transactional. I'll explain what I mean by this. It's caused by and worsened by the lack of understanding and support from family, friends, and the medical system. And of course, most importantly, by the inability to escape exposure. So the anxiety doesn't lie entirely with the patient. It's a result of interaction between the patient and society. Consider how many of us, maybe if you're healthy, for example, or our physicians, would become anxious if they were in a similar position. I suggest that many would. Now, another related issue, another elephant in the room, we often make the mistake of believing that a condition is either all biomedical or all psychological. As a psychiatrist working in this field, I've been agonizing over this for a long time, how to explain that neither of these are true. And I think I may have come up with a useful, however humorous metaphor. So spoiler alert, I'm a big fan of chocolate-covered almonds. So bear with me for a minute as I explain this view. I see MCS as being like a chocolate-covered almond. The almond represents the disease, the biomedical reality of the symptoms that occur when a patient is exposed to chemicals. The chocolate represents the secondary emotions. When it exists, and it doesn't always, the chocolate is added on top of the almond. It's created by the uncertainty and stress of having MCS, the lack of diagnosis, treatment, and support that I've already mentioned. The chocolate is not the cause of the almond. However, if there is chocolate, it's really important to note that both the chocolate and the almond need to be addressed in order for people to have full recovery. Unfortunately, because of societal stigma and disbelief, many people are reluctant to admit to the chocolate, the secondary emotions. Often in the past, when people have admitted these symptoms to healthcare professionals, they've been dismissed as having a psychiatric condition. And when that happens, their physical symptoms are henceforth ignored. So patients are pushed by the response of others into this false polarity. They're forced to deny that their health problem may have some emotional sequelae. In my medical practice, I would like to believe that it's quite different. I think because I've had the illness myself and I have a reputation of getting it, people trust me. They don't feel the same need to be defensive when they're struggling emotionally. And in my practice, people have been very willing to consider the big picture, by which I mean the bio, psycho, social, spiritual picture. The biology of the disease, the psychology of the emotions, the social stressors which occur with MCS, and the spiritual questions like how this is affecting our understanding of ourselves in the world, our sense of safety and connection. As you saw in the video, they can be shattered. So my take-home message so far is that although you may have had some bad experiences with uninformed healthcare practitioners in the past, please don't give up. Please seek emotional support if needed. The next question I was asked is, do I think that MCS is caused by mental health issues? This is very easy. The answer is no. In my 22 years of clinical practice, seeing hundreds of patients, maybe more, with MCS, most did not have a history of anxiety prior to becoming ill. Some did, of course, because anxieties are the most common category of psychiatric disorders in society. In the general population, 20% of people have an anxiety disorder at any given time. So probably about 20% of people with MCS may have had anxiety beforehand, but this doesn't mean that anxiety causes MCS. La prochaine question. Are chemical exposures implicated in the development of MCS? Again, simple answer, yes. There is so much research. I'm just mentioning here what I call the 3 C's. First is Claudia Miller's research, showing that many people develop MCS who were previously healthy after exposure to renovation fumes from remodeling their houses or from pesticide exposures. Then there's the Calgary courthouse. Many of you outside of Calgary may not be familiar with this. The old courthouse had a leak and developed mold. So many of the judges became ill that the government actually spent the money to build a beautiful new courthouse in Calgary. They realized the old courthouse wasn't salvageable and they needed their judges. And then we have the Camp Hill Hospital mold-induced MCS outbreak in Nova Scotia many years ago that led to the formation of the Nova Scotia Environmental Centre, now called the Integrated Chronic Care Service in Fall River, Nova Scotia. In my observation and experience, almost nobody gets MCS out of the blue without a chemical exposure trigger. I'm often asked, what are the tools for good management of chronic conditions? This slide is general for all of the what I call the alphabet diseases. I offer an online course about how to manage MCS and the other diseases. This is the briefest summary. First, it's really important to have an accurate diagnosis. If, for example, you're misdiagnosed with anxiety, you're going to get the wrong treatment and you're not going to get better. Once you have an accurate diagnosis, it's worth putting some effort into improving your sleep because refreshing sleep helps the body heal. For some, but not all people with MCS, their energy is affected. And if that's the case, then pacing is important. Doing activities as able, but not too much. A healthy diet is extremely important. I'll talk about that in a moment. And if strong emotions are interfering with your ability to enjoy life, managing them is important. Why be miserable if you don't have to? I'm going to talk a little bit later, maybe in the Q&A, about what type of treatment might be helpful. So these are general recommendations. In the next slide, I'm going to talk about tools specific to MCS. For all humans, all people living on this sadly polluted planet, it's wise to practice precaution. This means, as much as possible, work to access clean air, clean water, and clean food. In the short term, it's helpful to avoid known triggers, but in the long term, you need a more comprehensive plan. So back to diet. Genetics is the key to one key to detoxification. And there's a couple studies showing that people with MCS are more likely to have less favorable genetics for detoxification. However, before you purchase a whole bunch of expensive treatments or supplements, consider a healthy diet. For the detoxification genes to work, they need excellent nutrition. And you may ask, well, how are you going to get that excellent nutrition? And it's a colorful, diverse, real food diet with lots of plants and ideally organic. Another mainstay of environmental medicine is sauna. I would say dry sauna is preferred to wet sauna, but anything that makes you sweat will be helpful. Dr. Stephen Genuis from Edmonton published what I think is an amazing study called the Blood, Sweat, and Urine Studies, a series of papers in which he was able to show that when people take a sauna, and he collected the sweat in little bags under their arms, believe it or not, and the sweat contained a lot of toxins. So it's clearly an effective way to get rid of toxins from the body. In addition, a systematic review has been published on the effectiveness of dry sauna, and it reports evidence of benefit in many conditions, including fibromyalgia, myalgic encephalomyelitis, chronic fatigue syndrome. Unfortunately, MCS was not included in this study. Now, there are a few additional approaches I would like to mention specific to MCS. The first is mast cell activation syndrome. It's a recently described condition in which the mast cells, these are the ones that burst open when people have an allergic reaction. And in some people, they're more fragile, it seems, than others, and they burst open, releasing hundreds of immune molecules. It probably explains why some people with MCS are so sensitive, but it has yet to be proven. Although it doesn't explain all cases of MCS, I would recommend that you read up on MCAS. There's a reference in the final slides, and discuss it with your doctor if you can relate to the symptoms you're reading about, because there are tests available and there's treatments available that are easily obtained on prescription and relatively inexpensive, and they can be extremely helpful. If you've developed depression or anxiety secondary to your condition, please seek help. Don't wait until it's too late and you've lost hope entirely. If you have nothing available to you locally, you're welcome to join my online course, Pathways to Improvement, or read my manual, Let Your Light Shine Through, in which I mention other approaches to environmental sensitivity. In addition, on my webpage, on the Publications tab, there's a paper, you have to search for it. It's called Guidelines for Psychiatrists. And in that paper, I go into this topic in much more detail. There is a French translation on my website. Yes, so I wanted to end with that message of hope, that people are getting better. It's not a final sentence. And let's see here. Yes, so there's new research going on. You will hear some of these ideas in Dr. John Malot's talk on May 12th. And for yourself, try to find someone either in person or virtually who knows about MCS, who can validate your experience and guide you towards healing. The final two slides, which are going to come in a moment, contain the references that I've mentioned during the presentation. Thank you very much for your attention, and I'm looking forward to the questions.
So I can start with the first question. The first question is, does the definition of EI include people who are hypersensitive to light, sound, touch, and temperature? Is this more or less common than just having MCS?
Boy, that is a great question. I'm honestly not sure if the formal definition of EI, environmental intolerance, or environmental sensitivity includes people with other, what I call sensory hypersensitivity. So people who are sensitive to sound, light, movement, texture, taste, they are, I call them sensory hypersensitivity. Many people with MCS have these other sensitivities, and many people with those sensitivities have MCS. And I think maybe there may be a common biology between those conditions. I wonder if before the next question, I could just talk about what type of care people with MCS who are experiencing, we'll say, emotional overload may benefit from. And I would say primarily it's going to be counseling or psychotherapy support, helping validate the person that what they're going through is extremely difficult, and having strong emotions is probably a normal reaction. I would only recommend medication if, even with that social support, the emotional symptoms are so severe that they're interfering with their life or their safety. And sorry to cut in again, if I could add one more thing. I think what's critical with the validation is trying to get support to advocate for the things that will keep the person safe. So for example, the emotional symptoms aren't going to go away if a person has to work and the workplace is unsafe, or they want to complete their education and the educational environment is unsafe. So for MCS, it's not just about trying to help the patient reframe their situation. It's also about trying to get them objective help so that they're not constantly getting sick.
For our next question, it'll be, can chemical exposures cause anxiety responses in the brain? The question is not about secondary anxious responses, about the lack of support and acknowledgement and dismissal, but is there something that happens inside the brain at the moment of exposure to chemicals that triggers anxiety?
Again, I'm not an expert on chemicals in the brain, but my belief is that, and I talk about it in my article, I noticed someone put a link to the English version of the article in the chat, but there is a French version on my website. So in there, I divide emotional symptoms into 4 types. By far the most common are the secondary symptoms that people are reacting to the stress that they're under. And environmental, I list environmental reactions as one of the 4 types. So yes, I believe for sure chemicals can directly impact the brain and cause us to think and feel differently.
Thank you. Our next question is, if you suspect mold as a cause or contributing factor to MCS, what do you recommend in terms of treatment?
Right, great question. So if you suspect that you're currently being exposed to mold, getting yourself away from the mold or remediating the mold is critical. Without that, you won't get better. Once you've been able to get rid of the mold, or you have been able to move away from the mold, there's a whole complicated protocol of trying to figure out whether you have mold toxins in your body, because we react to mold for different reasons. One type of reaction to mold is an allergic reaction. And in that case, once you're away from the mold, you're going to be relatively safer. But another type of reaction to mold is due to the toxins that the mold produces, and those could still be in your body. I'm worried I'm talking too long for Michelle. And the treatment for that, there's a whole protocol. So you might want to read work by Dr. Richie Shoemaker. He describes how to try to get those toxins out of your body.
Do we have any more questions, Kelly?
Yeah, I think we have one more and then we can finish up. Why do you think the Provincial Health Institute would commission an evidence review that leads to false conclusions? Why do you think there is such a resistance to acknowledge environmental exposures as the cause, referring to the INSPQ report?
So I'm going to admit I have not read the report because I'm so busy and it's a huge, massive report. So I don't know. It's something that I've puzzled on for over 30 years. Why conventional medicine in general is so reluctant to acknowledge the reality of these diseases, MCS, fibromyalgia, ME, for example. I think it's due to multiple causes. There's no diagnostic test. Doctors love something that they can see that's objective. And the experience of people with MCS is by definition different than other people because people with MCS are reacting to exposures that most people don't react to. And most people have difficulty putting themselves in the shoes of others. Many reports, I can't comment on this one in Quebec because I'm not knowledgeable about all the politics, but I am old enough to know that many reports are commissioned and written for reasons other than to get at the truth.
If I may just add to that, if you want a full breakdown of what happened with that report in relation to a nonprofit charitable group like ours in Quebec, being stakeholders in this condition and working for people with MCS and related conditions, please go to our website. On the front page, you will see, read more about the INSPQ report. If you can find it, send us an email and we'll send it to you. And then you'll also find on the website a letter that you can send. With one click, your letter will go to the people responsible for change, to make change. And we basically want that report taken down. If you want that too, I can, you send us an email and we can send it to you. So this is what we should all get together and do. A lot of people think that this is a Quebec problem and it doesn't touch them, when in fact this is a published report and there is a plan to possibly publish more. And so it touches all of us, no matter where we live on this planet. If we or our loved ones or people we know experience MCS, it's up to all of us to take action. Would you be willing to take one more question? There aren't any in the chat, but if somebody wants to ask a question.
Somebody did.
Somebody did?
Somebody asked if anybody was cured from MCS by taking anxiety medication.
I don't think so. I think they may be cured of anxiety, but not MCS. I think they're not the same thing. And also, if the person is still being exposed to chemicals and they can't get away, the drug is not going to help their anxiety. I forgot to mention that the best cure for anxiety is safety. So if a person's unable to be safe because of their nobody's accommodating their MCS, then anxiety is unlikely to go away.
I think maybe,
okay.
Dr. Stein, thank you so much. And if it's okay with you and we don't have any more questions, Kelly, maybe we can end up.
I think we just have one more thing. Folks are wondering, will there be a copy of the presentation or a recording that is shared? But that's more for
Yes, so as soon as we have some time, which will be soon, we're going to divide this into English and French and have a bilingual copy with the video, with the presentation and the audio, and it'll be posted on the website. And you will know about it because we'll send an email to everybody to notify you. Thank you, Dr. Stein, for this very enlightening presentation. We deeply appreciate the time and effort that you have taken for this presentation and for your presence here today, despite your very busy schedule. I would like to inform and remind everyone that we have started a project for people with MCS, developed by people with MCS, to take back their power and address isolation, exclusion, stigmatization, and increase accommodation for the disability. It is titled Hand in Hand Across Quebec. It is bilingual, so we are open to participation from across the country. Everybody is very welcome. Please contact us. At one of our initial meetings, we had someone from the United States and somebody else from Italy. It was wonderful to have people from all over the world joining in, because we really need to know what is it that we need to do to reach out to everyone and to make things better for you. As you see on the screen, there are events on the 12th and the 30th. Please register for the events with Dr. John Malott and Dr. Dominica Tombasco. If you would like to join our mailing list, become a member, or have any questions, please reach out to us. And before I end, I would like to say something. Michelle, please translate. We have a lot of resources on our website, including for mold removal. And there is a letter for support to help you with your requests for accommodation. And in addition, please go to our blog and read our blog for May, which says, Take Back Your Power. Contact us if you need information on that. Thank you very much. Have a wonderful month of May and hope to see you on May 12th. Thank you.
Thank you all, and best wishes to everyone.
Thank you.
Thank you very much. Merci.